Hi, everyone. We're just letting people in now, so we'll just wait a moment as more come. Okay, we seem to be standing steady at 126, 300 plus actually registered. So I'll introduce myself firstly. My name is Carolyn Egan, and I'm co-chair of the Greater Toronto Health Coalition. And I want to welcome you all to this really exciting forum this evening. And we're just thrilled that so many of you have been able to join us this evening. And I just want to say, and I think all you know it, we are really in the fight of our lives. The same enemies, if we want to put it that way, that Tommy Douglas. Could people please mute themselves just so that we can just hear the person who's speaking at the moment they are speaking? Thank you so much. I'm just trying to say that we are very much in the fight of our lives. The same privateers that Tommy Douglas was speaking. Are we all right there? Okay, so the same privateers that Tommy Douglas was fighting way back when, the decades ago, that he initially started the fight along with so many others in this country for public health care. They have risen again, and they are fighting a very tough battle here. They are trying to essentially destroy our public health care system. And this is nothing new to the Ontario Health Coalition and our many allies. And we feel we're putting up a tremendous defense, and I think that we're really having a very real impact on the debate. So I think we can go into this meeting with confidence, appreciating that we're one of many coalitions, 30 to 40 coalitions across this province who are doing these same types of forums and are engaging people in the same way we are. Just a while back, we had a meeting of over 1,000 for the whole of this province. So again, I want to welcome you. Some have been here for the many of our meetings for years, perhaps. Others of you may be just joining us this evening. So we are very happy, and I think you'll find this a very engaging public forum this evening. And before we begin, I would like to do a land acknowledgement, if you will allow me to do so. We acknowledge the land we are meeting on as the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis peoples. We also acknowledge that Toronto is covered by Treaty 13 with Mississauga of the Credit. Today, this meeting place is still the home to many Indigenous people from across Turtle Island, and we are grateful to have the opportunity to work on this land. And we say these words, which are incredibly important, but we also work in our day-to-day lives to strengthen those bonds. And just on February 25th, we took part. Natalie, our executive director, spoke, and we took part, a very strong contingent from the Health Coalition with so many others, including Indigenous peoples, who brought all the varying issues that we are fighting the Ford government around together. So we would only say the words, but we take active participation in those struggles. So I want to begin the panel, so we have enough time for you to really hear the lessons that are coming out, the experiences that the speakers are going to provide to you, and allow also a question and answer. And we're going to end by telling you next steps, ways you can get actively involved for those who haven't yet signed up for the coalition. So I'd like to begin, if I may, by introducing Nicole Payette. Her daughter is reliant on home care, and she has been a staunch advocate for patients. And we've heard her before, and she has a very compelling story. I think that if you have any doubt about the problems that are being confronted, she will convince you. So Nicole, would you like to begin?
Good evening, everyone. I'd just like to introduce myself. I'm Nicole, and I have a daughter named Alexa, who's 11 years old. She's a medically fragile, I guess one of the most complex and medically fragile children in the province, and she's palliative. She was born with an extremely rare disorder called intermediate salivary disease. So it'd be something between ALS and MS. So she needs care 24/7, and she's nonverbal. She's on a ventilator, everything you can think of, GJ tube fed. We take care of everything for her. She also has unresponsive seizures that we have to resuscitate her during. So we're doing ICU specialized care in the home. So the issue we're having is with the publicly funded nurses, there's been a nursing shortage because of the pandemic, but also because of the low wages in the public system. So a lot of the nurses went on to work in hospitals and long-term care. So unfortunately, these nurses have not been replenished in the community. So we're basically dealing with a lot of shortages. I even had one of her agency CEOs come to our home, and basically she stated that they haven't been able to give an increase to any of their nurses because the Ford government is not allocating that funding for wages. So they do get, it's a nonprofit, they do get money, but they can't use it for wages. So these nurses have not had a wage in over 4 years. And so we can't compete with these nurses move on and go into these these private agencies. So we can't compete with the higher wages. So they leave and move on. And now that leaves us with very little to no nurses in the home care piece. The other piece is that home and community care has been discharging families of medically fragile children in the community, because if they're not using their home and community care hours through the Ministry of Health, they are discharging them or forcing them into family managed home care, where the family takes care of everything. It's like running a business. So we had to switch over because of necessity to private nurses. So we were allocated funding through the Ministry of Community, Child and Social Services to offset that. So we had additional funding for 2 years. As of April 1st, our funding has been cut in half. So now I'm in a difficult position where I've been blindsided, as well as over 100 other families with the most fragile children in the province. And basically they're putting us in crisis. So now I have a team of nurses, but I can't pay them. They cut my funding. So I have home and community care money through the Ministry of Health that I can't use because there's no nurses under that I can hire through those agencies. So now we're in a really, really big crisis, and there's no transition time or funding that they're giving us at this time. So now I'm really advocating, because we are in panic mode. So basically, as of April 1st, I will have open shifts that are done on purpose because I can't pay the nurses. So basically, the only option that they're giving us now is to switch over to family managed home care, which was never meant for families like myself. The most complex of families, it's not something that you want to do, because you're basically running a business. So you get a pot of money. The rates don't match the actual rates of the agencies or like that they actually allocate to you. So what's happening now is they want us to pay the difference, which goes completely against the Canada Health Act. So now I've got to be able to show that, so then I can go to the federal government with the Minister of Health and say, like, they want us to pay, which is totally not okay. We can't afford to pay hundreds of thousands of dollars for home care to pay, or these would be publicly funded nurses and privately funded nurses. So basically, we're really in crisis. Also, the private agencies right now are wanting to charge us $100 an hour for nursing. So even my private insurance, I'm capped at $60 an hour. I'm expected to pay the difference, which is $40 an hour. So again, families are asked to pay, and none of the funding that we get will offset the difference. So really, we're kind of stuck between a rock and a hard place. Also, for us to basically be in this position, I would probably have to let go of some of my my private nurses, because I can't use the public funds with them. So now I'm kind of in a crisis situation, because my daughter needs such complex care needs. It's ICU level care. These nurses have been with her for a number of years, and now I'm basically having to get into a position now where I may have to let go of nurses, and there's no continuity of care. So at the end of the day, it's taxpayers' money, one way or the other. It doesn't matter which ministry it's coming from. Because the money is not in the right pot of money, it looks like they want to basically, put us in a crisis situation. So at the end of the day, I think they forgot the impact it would have on the child and on the effective continuity of care. And this is not patient-centered care that the government had disclosed that they would be focusing on. So at the end of the day, I'm not sure what we're going to do. So hoping that this helps letting people know what's happening, and that eventually we can come to some resolution. But with the child advocate being let go years ago from the Ford government, now we have no one to go to advocate on our behalf. So a lot of the mechanisms we had in the past for the pediatric population is now gone. It's left on the families to take care of everything themselves. So I guess that's it. I'm trying to stay positive, and hopefully we can get some help soon. Thank you.
Thank you. Thank you so much, Nicole. And, you know, I think your words are so incredibly compelling. And I think your courage and your persistence and your really commitment to fighting on this is just, I think, remarkable. And thank you so much. Such an inspiration.
Thank you. We're just really tired. It's been a long pandemic. It's been a long, and it's not done yet.
No, it isn't. And that's why we're all here to fight that fight alongside you. You're not alone, as you well know. But thank you so much for your words. So we'll now go on to Dr. Hal Berman. And he is a palliative care doctor who works in the palliative care at-home program in the city of Toronto. So Dr. Berman, would you like to go now?
Hi, thanks so much for having me tonight. And actually, speaking second is actually very difficult because I don't think that I can actually convey the issue as eloquently as Nicole has just done, because it's about her and it's about families like hers that where people are suffering, and it's about them. It's not about me. Just to tell you about myself, I'm a palliative care physician. I'm an internist and a palliative care physician. I work exclusively right now in home palliative care through Mount Sinai Hospital. I'm also in a leadership position. I'm a chair of District 11 of the OMA, Ontario Medical Association. So I just have to say that the things that I'm going to say today, they're my opinions, and they're not necessarily opinions of either Mount Sinai Hospital or the Ontario Medical Association. And I'm sure that they will be relieved that I'm saying that. So I've been working in palliative care now for about 20 years, and in home palliative care exclusively for the last 10 years. And it's only gotten more and more difficult. Even before COVID, we had difficulties getting people the care they need. You know, for somebody who was just coming onto our program, they were eligible to get 14 hours a week of PSW support. And this is mostly adult. For people with ALS, things are a little bit, in children, things are a little bit different. At the time, though, it was fairly easy to get those PSWs to come. If somebody needed, somebody twice a day, we would ask home care, and whatever they were called, home care, CCAC, the LIN, now it's home and community care support services, they would get us what we needed for our patients. At the last 28 days of life, people were eligible for 56 hours a week, which could be an overnight shift or 8 hours a day or 2 days of complete care, and then some days with no care, but whatever they needed. In 2019, the Minister of Health, Christine Elliott at the time, promised that home care was going to be changed so that everybody got exactly the home care that they needed, the number of hours that they needed, and there wouldn't be any preset maximum. And even though I should also mention that I have been a candidate for a different party in provincial and federal elections in the past, even so, we welcome these changes because this is what our patients needed. That never came to pass, unfortunately. And then what happened? We had COVID. And COVID threw a complete wrench in all of this. We lost a lot of PSWs to either getting COVID or to leaving for jobs in institutions, or simply leaving the job for a better work because it paid so poorly and there was no PPE for PSWs. It got to the point where people who were eligible for 14 hours a day can't always get, 14 hours a week, can't always get 14 hours a week. Sometimes there's PSW doesn't show up, maybe they're sick, but the agency isn't able to get a replacement for them. I've had care coordinators, and these care coordinators, they do try their best. I know that when we're looking for help, it's almost an adversarial position sometimes between the family and home and community care, but the coordinators who have been working for months or years with these people are trying their best to advocate for them. And if they are eligible for 56 hours, sometimes I've seen them have to cobble together these hours with 3, sometimes more agencies to provide this care, because each agency doesn't have enough staff to provide this care. So, but why is that? Well, Bill 124 did not help. A lot of people couldn't afford to support themselves and provide this kind of care at the meager wages they were getting. And I know this was the same for nurses and for pharmacists in hospitals and for many professions. That PSWs, who are among the lowest paid healthcare workers in the province, are the ones that really suffered because of this. And I don't want to minimize the suffering of other professionals as well. Really, the only ones who didn't suffer were the doctors, although I'm sure that the OMA would not really be happy to hear me say that. But we were the ones who suffered least, but we suffered in a different way. When we can't get the care for our patients, that is very difficult. And the result is that some people couldn't stay at home. They either had to go to the hospital, or they ended up in emergency departments and died in the emergency department, or if we were lucky to get them into them, they got into a PCU, a palliative care unit, or a hospice. But care in a palliative care unit or in a hospital is more expensive than caring for somebody at home. So it actually costs the system more money and provides care that the patient doesn't want. It doesn't provide the care that they want. For people who want to stay at home, it is less expensive and much more comforting for them and their family. So how does this tie into privatization? Well, many of you may not realize, although home and community care is the one that assigns the hours of support, they're not the ones who provide the doctors, the nurses, or anybody, except for nurse practitioners. There are some palliative care nurse practitioners hired directly by home and community care services. But nurses and PSWs come from agencies. Some of these agencies are not for profit, but each agency has its own duplicated system of administration, and it's very cumbersome and very inefficient. If, on the other hand, we had a single agency run by the government, this could potentially allow us to put more of those public resources directly into the hands of the people who need the care. They would get PSW support, they would get nursing support. This is why the private system doesn't really work, but it gets even worse. Right now, there's going to be money bleeding from the public system to the private system because the Ford government actually plans to spend more money on facility fees in private institutions than they actually pay hospitals for the same procedure in hospital. Where does that come from? It comes from the healthcare budget, which means there's less money available for other things. And this isn't, we're talking about home care, so we're not going to go into big details about how to make it more efficient to ease the backlog publicly. But if we were to do that, more money would be available for home care, and we would be able to spend more on things that we need in the home. And so people like Nicole wouldn't have to be struggling. And maybe she can afford to pay $40 an hour for the nurses who are getting $100 an hour. And maybe she can, but I can assure you that most of my patients cannot afford to pay extra for extra care. Because if you look at it, $40 an hour above the cost of what their insurance is going to pay, that's $1,000 a day if you need 24-hour care. I can't afford that. And if I can't afford that, my patients can't afford that. So what we really need is a public system with appropriate funding, well run, with a single agency so that we can maximize efficiency and get people to the care that they need. Thank you.
Oh, I think Carolyn's frozen there. Thank you so much, Dr. Berman. So our next speaker that we have to speak today is, sorry, just a second.
Since we're waiting, I might as well add one thing that I forgot to say. What I didn't mention is that the problem is so bad that sometimes now there are certain agencies who provide palliative care nursing to various areas who don't even have an on-call palliative care nurse because they don't have enough staff to provide on-call nurses every day. So that there are some days when you can't get a nurse if you need one because there just isn't one available. And that's just going to get worse with privatization.
Thank you, Dr. Berman. And
Thank
next
you.
we have James Cushing, who has a family member who suffers from dementia and is reliant on home care as well. And he's going to share his experience with us.
Hello, I'm James Cushing. I'm going to be talking about my brother-in-law, Lloyd, who's currently 83 years old. He started showing signs of dementia about 5 years ago. And as soon as that was diagnosed, my sister leapt into action. Marion is 81, and she became his biggest advocate. The system is self-reliant. You're expected to chase down whatever you need and negotiate with sometimes unreasonable people who are not willing to help out that much, it seems. But she kept at it, and she actually enlisted him in Toronto Western for a research program where there were something to do with electrodes and triggering responses in the brain. So that went on for about a year or so. And it seemed to actually slow down the dementia. But as soon as he came out of that research program, it seemed to speed up fairly quickly. And he's especially deteriorated in the last year and a half or 2 years. So that's when, and of course, through this, Marion has taken the brunt of care. Us as a family have tried to spell her off as best we could, here and there, trying to fit into the schedule where she needed to do, or sometimes she even just went to have social activity at the community center, that kind of thing, because she needed those breaks because she was getting burnt out. And towards the end, I got really worried about her health. So basically what I could tell you about the home care, Monday to Thursday, she would get a half an hour in the morning for shower. Now, these usually represented different people coming. So he seemed to like familiar people, the ones that he knew that came regularly, but that didn't happen. You had this rotating door of people. So he's very resistant to having people, basically try to take care of him that were unknown to him. So Marion always had to be there to try and stabilize him and keep him calm because he'd get very upset. Now through this period, and this would be, up to about maybe September, and he couldn't walk very well. He had to have a walker, but he could walk, and he could also feed himself. So he was doing okay that respect, and he could even walk down the hall and go to the bathroom. Of course, sometimes he doesn't hit the bathroom, but basically he could do that. So there's 4 mornings for the half hour, and then you were asked how you wanted to break up 3-hour increments that equal to 30 hours a month. Now, if you think about that, 30 hours a month for somebody that is probably, I'm guessing, but he's probably about 6'2" and over 180 pounds. And my sister is 5'0" and maybe 110 pounds. So you can imagine anytime you ran into a situation, and she had to do it towards the end. If he fell, she could call paramedics. They wouldn't take him to the hospital, but they would come and pick him up. So that's all they did. But that was good that she had that aspect. So the 30 hours a month, she used Thursday and Fridays for 3 hours each day. And then every second Wednesday, she would get a 3-hour. Now, same thing happened with this. Rotating staff were inconsistent. Some of them weren't trained on Alzheimer's patients or dementia patients, so they didn't know what to do. Every time you had a new person come, Marion would have to go through explaining what Lloyd was like and the kind of things that he needed to take care of him. The ones that at one point he did see some sane people that were really good, and they got to know him, and he was comfortable with them. But as soon as this rotating door of different people came in, it was terrible. The other part was you sometimes had last minute cancellations. You know, they'd call up, say, oh, I can't come this day. Can we change it to another day? So you'd have that, or the time would have to be changed. They did, the Alzheimer coordinator supposedly was not very helpful either. They tried to set up physiotherapy. It worked for 2 times and then it stopped. We couldn't get that going again. Eventually, like Marion tried as long as she could. She, even in the summer, Lloyd is from Newfoundland. So she wanted to take him back to Newfoundland, which was really a struggle. She had to have people to help her to take him back, just to see the family one last time and to see his friends and all that. Because he was deteriorating so quickly that we didn't think he'd be able to travel after the summer. And we were right. Come the fall, he really declined. But then the next hurdle was to stay around till Christmas. So Marion fought like hell and was courageous as hell to keep him in the house until Christmas, which she did. And unfortunately, this last couple of weeks, he fell about 4 or 5 times. So it was getting to the point where we were afraid he was going to break a bone or cause some real damage because he kept falling. So unfortunately, come the new year, he went to the hospital. So now he's in the hospital and they put him on chemical restraints because he was boisterous, and that certainly quietened him down. In fact, now he's gotten to the point where he doesn't eat, he doesn't do anything but sleep. And when they tried to do something like change his diapers or whatever, he fights them all the time and he says, "You're killing me, just let me die." So this is a person that has Alzheimer's, that is aware of the fact that they're being mistreated in a hospital. He's already caught COVID. He's gotten a bladder infection. He's also gotten Norwalk virus. And now we have an outbreak of COVID again in the hospital.
James, it's a terrible story, a terrible story.
Yeah, it is. It's awful.
Yeah, yeah. And, you know, I think as we listen to you, it's not an individual story. I mean, what you're saying, thousands and thousands and thousands of families across this province are confronted with exactly the same thing. And it's very compelling. And we so appreciate you sharing, because it's not always easy to share family stories like this, but I think it just enriches the conversation, but makes it so incredibly necessary for us to just change the system that's having you and your family confront this. So thank you very, very, very much for your comments. And I think that the next person that you're going to hear from is coming from a different perspective. Connie Lovo, she is a PSW. She works in home care. She's president of a CUPE local that and has been fighting along with her fellow workers, local 7797, to change the conditions that they're forced to work under. It's not because the PSWs are liking the circumstance that they have to deal or the constraints under which they provide this type of service. But I think this will add an interesting dimension, and why we have to ally with the workers who are providing the service, as well as the families and the patients who are so desperately needing it. So thank you, James, and please welcome Connie to the conversation if we could.
Okay, thank you, Caroline. and thanks everybody for having me here today. I'm actually in Vancouver at a women's conference, so I'm really fired up. Yeah, so I was asked to speak on two things today, the home care over the years and after the pandemic. And I just want to say, Nicole and James, your stories are very, powerful. They're very compelling. And it's the stories that I see, I don't hear, I see them every day. I've worked as a home care PSW for over 20 years. And over the years, home care has been deteriorating to where we are today, where it's not just the pandemic. I think before the pandemic, home care, in my opinion, had collapsed to an extent that what we're hearing today from Nicole or from James shouldn't have happened if our fight for home care was saved or heard or even listened to many years ago. Because when the government stopped funding home care, honestly funding home care, everything collapsed. You cannot look after someone who has dementia, old, and they're frail, and you're just going to give them 1 hour per week for their care, and they're bedridden. So I've gone to many homes where I end up have to use my own time to ensure that the person is living in their home, but that place also is livable. I have to take out their garbage after giving them a shower. I have to remove the diapers. I have to do the laundry, but I'm trying to fit all that in 1 hour, and it cannot. And why is it 1 hour? Because this is what the government is funding for, 1 hour of care. They are lucky if they're gonna have maybe like 3 hours of care per week, but it's less than that. And it's becoming less and less and less every day. The government tries to do so many things and say, okay, let's do the cluster care where you can put, the old and frail seniors in this senior building. And then we're gonna send PSWs to go and help. And then the traveling time is gonna be less and less, but we're still spending less than an hour with one person. So the dignity of care is being eroded, or it's been eroded by this government when they're trying to make home care a private company for profit. It shouldn't be. It should remain as a public necessity. Healthcare should remain public, don't make it private. So we've seen all these things over the years, but also what has it done? Our hours of work are dependent on how many hours we make per day. So when you reduce funding for home care, you also reduce how many hours one can make in a week. We don't have full-time jobs in home care for over 20 years. We're working precarious jobs. I know the doctor talked about, PSWs working 3-4 jobs after the pandemic. It was way before the pandemic that we have multiple employers just to make ends meet. The wages have always been unattractive. Poverty wages, no benefits. We get injured at work. You are lucky to end up, if you're in a unionized place, at least there's gonna be WSIB, but if you're not, and as we know, sitting here today, that there's many PSWs in home care who don't even have a union. So you can close your eyes and see how much exploitation do these workers get. But also what is even more compelling is that the people who work in home care are women who look like me, Black women of color who came in this country as immigrants. They live in marginalized communities, and most of them are single mothers. So it becomes also a gender issue that we see home care not really putting the money that should be put there. Is it because you are looking also as who works there? Is that a racial issue? Gender issue is women, but also it's Black women, racialized women who are actually working in home care, struggling every day to make ends meet, but also facing violence, facing exploitation, because also as the government fails to fix the issues in home care, they want to come up with all these big, words to say client-centered care or family-centered care. So even if I'm going to help this client, sometimes there's family, and I'm a family person, don't get me wrong. But when I'm going to see Mr. Brown, when the family begins to interfere, it becomes very difficult to do my job. And most of the time, as a PSW, I've been trained to know what Mr. Brown wants, but not what the family is wanting. So many times it becomes very difficult to work in this sector where you've got multiple bosses or employers. But then I'm just going to go quickly, to the pandemic. So what happened during the pandemic? The home care actually did finally collapse. I will say that because I saw the agencies where I work losing workers. Workers had to go to long-term care or nursing homes. And not because they were going there for higher wages. Yes, of course, we always want high wages. But what happened is that the government actually decided not so that we don't spread the COVID. We're only going to work for one employer. And you're only going to do essential services, which means you just go and give someone medication, give them a shower, take their diaper out, make them a cup of tea and leave. You're not cleaning, you're not doing anything. Because also there's funding for homemaking and there's funding for personal care. So we did lose the hours of work, which were home care hours. So we're only left with personal care hours, which could just be an hour or 2 hours that we're going to have for the entire week. So people left home care and they went to long-term care. They were going there to get guaranteed full-time hours, which doesn't exist in home care, and making our jobs very, very difficult. So that's the problem right now that we're facing in home care. Even today, after the pandemic, agencies like Sprint where I work or TNG where I work, they're having a hard time to get PSWs to come back and work because the wages have stayed even lower, right? We thought maybe by end of the pandemic, it would be clear what is wanted to fix home care. More funding, full-time jobs, good wages. But no, actually, what the government learned from the pandemic is to bring the competitive bidding back into home care, which is actually, we're going to see more privatization of home care, and we don't need that in home care. These stories you're hearing from Nicole, from James, these are about people who need quality of care. It's not a sin to be unwell or to be old and frail and not be able to give yourself shower. So why do you want to privatize that? And when you do that, you take away what is called continuity of care. So you're seeing many people come through your door every day. It doesn't matter how old I am, I still need privacy. I still need to know Connie is gonna come and give me a shower on Wednesday, only Connie. And when she's not well, at least they're gonna send someone, but not too many people that we're seeing going in home care today. So it's very sad, it's pathetic, it makes me angry every day because the dignity that we need to be giving people who need the care is gone. It's not taken by me, it's taken by the very government that called us heroes maybe during the pandemic, but we were called heroes. Home care workers were called heroes or anybody in healthcare, but they forgot that the home care workers, PSWs like myself in home care during the pandemic also needed PPEs. Some went to long-term care for full-time jobs, but some passed away, some died because they caught COVID, because they only had 1 mask per day or 2 masks per week. We had to use the mask, put it in a bag, go to the next client. How is that supposed to prevent infection? But this is what was done in home care. Even when the vaccine came, we were the last one on the spectrum to get the vaccine. So when we're talking about PPEs, we were the last ones to get the PPEs. But these are the issues that I'm talking about. Home care is always the last on the spectrum of whatever budget is coming when it's healthcare, the home care is going to be put down there. But on the other hand, we talk about the old, frail seniors. We talk about the aging population. We talk about saving money because we know when people stay in their homes, they save more than putting people in long-term care. Those beds cost a lot and it's a long waiting list. But we also know what happened in long-term care during the pandemic to an extent that those who can afford, they really don't want to send their loved ones to nursing homes or to long-term care. They want their loved ones to remain at home, but they also need help through the PSWs. And the PSWs also want decent jobs, jobs that are paid well, respected, less exploitation, less violence. We need benefits. We need to retire and have something to fall on. We don't have pension in long-term care. And we didn't start talking about this because of the pandemic. We've been talking about this, as Caroline is saying, so many years we've been out there lobbying the government, asking for funding. telling them the truth that when I work 1 hour a week, how am I going to have a decent life to pay my bills, to send my children to school, to put food on the table? So we are really at crossroads today, but I know the people who are out there depending on my help. I also know those who went to long-term care, what the government is doing is trying to remove them and send them somewhere else where they don't want. So that's not the way to fix home care. Competitive bidding is gonna kill us. We can't privatize home care. I would rather work even in a unionized environment, because when it's private, like I'm telling you, we still exploit it even when you have unions. But where you don't even have unions, it's even worse. So when they privatize, we'll see ourselves going back to $10 an hour. And as you know also, there's just so many levels. Even when they gave us $3 during the pandemic, it's also, they say it's permanent now, but how can it be permanent if you're only making 6 hours bi-weekly?
Connie, it's so compelling what you're saying. It's extraordinary. And I think that the strength of that you're speaking with today, and I mean, you and I have known each other a long time. We've spoken on panels together. We've worked together. And I think what makes the Ontario Health Coalition so strong is that it has all of the components. It has the families. It has the people who are receiving the home care. It has the workers like yourself, the unionized workers, the non-union workers who are coming together to fight back. And you know, as some people have been saying in the chat, the government knows full well you can't convince the government. You're absolutely right, and we're not here to convince the government. Connie knows that. She's been in negotiations. She knows what it's all about. We know they know exactly what they're doing. What we're trying to do is convince our fellow citizens, our fellow workers, the people in our communities, that the lies they are putting forward, exploiting workers like Connie, exploiting and oppressing families like James, and all that we've been hearing today, and that's what we're all about here. And I just want to thank you, Connie. I know you've interrupted a conference out there in Vancouver, and you know, you've just given a powerful testimony about what people who are having to put up with, and we know where they're wanting to go. They want to downgrade the workforce, and they want to take our services away just to enrich those who are powerful in our society. And thank you so much. Thank you for all that you brought to this event tonight, because it just brings such a richness. And we all appreciate your taking the time out in Vancouver at a conference, and we appreciate all of that. Thank you so much. And we'd like to go now to Penny Moore, who wants to share her experience with the short staffing and the quality of home care, to bring another voice to the conversation here, and just have the voices, as I say, of so many different components of the struggle, all people, all suffering in their own ways. And I think the stories just are going to make us stronger and give us the ability to talk with our fellow trade unionists, our fellow community members, our family members, so they understand what in truth is at stake. So Connie, thank you so much. And Penny, would you like to add your story to what we're listening to this evening?
Thank you, Carolyn, for inviting me. I have been through, I know all 3 levels. I was an RPN back in the 90s. My mom had services, and me and my sister had to share the care of that. And now I'm a 22-year cancer survivor, and I've had home care since 2001. In the beginning, I would get housekeeping, I would get showers, I'd get like 3 or 4 times a week. Then over the years, it's decreased, and just before COVID, I only get twice a week, and it's only 4 showers. Requested more hours, especially a year and a half ago when I was in the hospital and I had 3 mini strokes. And each time when I've been up in the hospital the last 4 years, when I'm discharged, I have been discharged without nursing. I've been discharged without PSWs. And when I had the mini strokes a year and a half ago, I ended up spending 5 days in my wheelchair because I was discharged with no nursing or PSW. And when I refused to leave the hospital without the supports in place, I had security called. I had security packing my stuff up. I had security escort me off the property and tell me I would be charged with trespassing because I request not to be discharged because I live by myself. I had 3 mini strokes. I had limited use of my left side. I was learning how to walk again. And imagine sitting in your wheelchair for 5 days and no one comes. I even had to get one of those alert buttons that you press if you fall. And it cost me $80 a month for me to pay for that. I'm on disability on ODSP, and ODSP does not pay for it. I don't even get a deduction on my income tax for it. I've had it during COVID. It got worse because I was getting different PSWs coming. I've had it put it on my file that I wanted them to call the night before so I know what time to come. Because at the time I had an 18-year-old Jack Russell, and like he has to go outside, he has to go for a walk, he has to go out and do his business. But if you don't know what time your PSW is coming, I can't do that. And when I do that, and they don't call me the night before and they just show up, and I don't answer the door because I'm out walking the dog because I didn't know they were coming, that they do what's called a wellness check, is what they call the police, and the police come and break down your door. I've had damage done to my place because of it. I have post-traumatic stress disorder, which has been made worse over this. And like I do programs in arts and that, and I also do community involvement. But I can't do that when I don't know they're coming. I can't arrange them. I had to fight for the last year and a half to get my regular PSW that I really trust. She talks to me as a person. I get respect from her. And she calls me the night before. In fact, just before I spoke, she called to tell me to be here what time, because I have to do a tax clinic tomorrow as a volunteer. So she asked me, what time do I need her tomorrow? If she's sick, I don't get anybody. And with the agency, which is a private agency through the Southwest Land and the CCAC, home care, whatever you want to call, they do not call me to tell me no one's coming. They don't call me to tell me that she's sick. So I could be here waiting all day for somebody not to show. I went 3 weeks without a shower about 6 months ago. I'm diabetic, and it causes skin infections. And also, when I sat for 5 days in my wheelchair, I ended up back in the hospital for another 3 months. And if you're in the hospital for a long period of time, I believe it's 3 months, you get discharged from the system. You get discharged from home care, and you have to reapply, and you may not get the same agency, so you get different people. I've had PSWs before I got my regular one back, they call and say, I'm in the parking lot, I'll be there in a second. I said, no, you won't, because I'm out walking the dog. Like, it angers me that we get treated this way. It's disrespect. Our dignity is not there. Even though we're supposed to be part of the community, we're not part of the community. You can't go get groceries. It, like, some of us even thought of maid because of the treatment get. I'm supposed to get 45 minutes for a shower twice a week. Before I got my regular one back, they were only here 5-10 minutes, do my shower and out the door. If I asked them to sweep something off the floor, they didn't do it. But my PSW I have right now, she goes beyond the duties that she will sweep the floor. If I had something in the dryer or the washer that I'm not supposed to be lifting, she'd take it out for me if I asked her. That makes us feel better. The system has to be better. I ask for more help. I don't get help. I can't. There'll be days I'm in the same clothes every day because I can't undress myself. But yeah, I only get 2 days a week. And it's not fair. It is not fair. I was a taxpayer payer. My parents were taxpayers. Like, it doesn't matter if I'm on a disability or not. We just want to belong. We want to stay out of the hospital, because we go to the hospital, you get sick because of the stuff that's going around. When I was,
I think, you're so articulately outlining exactly why this system is totally broken. And I think that what you're adding to this conversation is the personal story of someone who worked hard all her life and now is expecting to be treated with dignity and respect by the society in which you contributed all those many years. And just as Connie was saying, whether it's a worker, whether it's someone like yourself who is a recipient of care, it is totally disrespectful what is happening, and they're trying to make it worse and worse and worse. So thank you for your conversation on this.
It affects the patient, affects the family, and affects the community. And when you have more than one PSW coming in at a time, with COVID going around, we have to test almost every time somebody is different.
Yeah, it's not a rational system. Yeah. It's not a humane system. It's a system that is just totally not meeting the needs of people, the needs of workers, the needs for the medical profession. It's not. And thank you so much for this. And I think what we want to do is see what we can do as a whole, all of those who have come together in this, which is like many forums similar to this happening across the province. And so thank you so much for that. And I'd like to now introduce Natalie Mera, who is the Executive Director of the Ontario Health Coalition, who has been just putting untold hours over many years fighting this. And she is part of the leadership of the fight that's going on right now. And I think that Natalie will have really important words for you right now about what next steps are, pulling us together here and seeing where we go from here. So Natalie, would you want to come to the fore at this juncture?
Okay, thanks. Thank you so much. Holy, that is, it's hard to hear, really. And just thank you, all of you, for bringing your perspectives. I think people painted a very clear picture of what a travesty home care is. And if it's okay, I was just going to quickly walk us through how we got here, and the sort of the themes that sort of cross over in what's happened. Public Medicare was created when hospitals cared for the ill and home care for the frail. And this has changed dramatically over the last 30 years, with much more kind of clinical care being provided at home. as well as a significantly increasing number of the frail and the elderly, as well as people with disabilities requiring support at home. Through this time, the support of Canadians for the idea that healthcare should be based on need, you know, those principles that equity and compassion should be foundational to our approach to healthcare, as you hear from everyone on this town hall or this public forum, remain very deeply held values. But contrary to these public values, home care has been deeply privatized and corporatized over the years. I wrote a chapter for a book on the corporatization of healthcare, and it was both on hospitals and home care. They put the hospitals part in the book, but they didn't put the home care part in the book, but it's written up. So if anyone is kind of looking for this background, we can send it to you, and I'll make sure it's posted on the website. But very, very quickly, so from the 1990s on, basically, hospital restructuring was about moving as many patients out of hospital as possible. It was sold to us as, you know, people would age at home and would have the ability to choose where they age. And then the hospital cuts were sold to us as reaping administrative efficiencies from hospitals. Hospitals would be integrated and all this stuff. We'd have less beds, but people would get more care at home and so on. In fact, what happened was the vision of home care as long-term care in the home for people with disabilities and people with chronic illnesses and the elderly who are aging morphed into a cheaper place to move people. That's essentially what happened. And home care was strictly capped. To facilitate and when they cut and offloaded, so the Harris government cut about 19,800 hospital beds. Half of those were the chronic care hospital beds, the longer term care hospital beds. They cut in half the chronic care hospital beds. They cut in a third the acute care beds in the province, or by a third. And then they privatized home care. So prior to the 1990s, home care was delivered by municipal public health departments, public hospitals, the Victorian Order of Nurses, and it was under the home care program, and budget shortfalls were paid for by the provincial government. At the time, the groups representing the elderly criticized the system as fragmented and inequitable. And in the early 1990s, the NDP was in power, and under the Bob Rae government, they went through extensive public consultations to reform home care. And what they came up with was a plan of regional planning bodies called multi-service agencies that would provide a public system of home care. So home care was to be public, and it would be able to integrate with other community supports and so on. And the vision was that people would be allowed to age in place. If they were elderly, if they had chronic care needs or disabilities, they would be able to live independently in their homes if that was their choice, as long as possible. They passed legislation in 1994 to establish that, but they never enacted it. So the legislation was passed, but it wasn't proclaimed by the Lieutenant Governor General, and it was never put into place. Then the Harris government came in, and who remembers the Harris government here? Most people, many people, you're old enough to remember. Okay, so this was an arch, cut and privatize everything kind of government. And so they cut all of those hospital beds, 19,000 hospital beds, and then they privatized home care and they privatized long-term care. And so what they did was they took the existing home care services and they invited for-profits in to bid against the existing services to provide the care. And so all these companies, I remember it was like We Care, You Care, ComCare, Paramed, all of these companies moved in and they underbid the existing nonprofits and the municipal home care. So a bunch of, I think the majority of which was unionized. They got the contracts. And then over time, because it completely destabilized all of home care, they reduced how frequently the bidding processes happen. And then the Liberals, when they took power, kind of froze that in place. And so just to give you a sense of what happened in 1995, 82% of home care nursing was delivered by nonprofit entities and 18% was for-profit. By 2011, only 42% of home care nursing was delivered by nonprofits, and the majority, 58%, have been privatized to for-profit companies, and that has deepened ever since. And so in order to facilitate privatizing, so this was all about privatizing who owned and controlled home care and who could make a profit off of it. And in order to facilitate that, they had to fundamentally change home care. So you no longer had a nurse and a case manager and a PSW and, you know, the speech language pathologists and the physios and so on, OTs working as a team. You had to split it. So there was an entity that would run the bidding process. And then there were all these companies that would bid on the contracts, and home care had to be a widget-like chunk. So an hour visit, you know, so no longer was it a holistic service where you went in and provided the care and homemaking services and so on that someone needed. Not that it was perfect before by any means, but it, you know, fundamentally changed it to fit into a market system. And then as we were criticizing, you know, you'd have a company lose the contract, and the company that won the contract would have no employees at all, would aim to hire all of those laid off nurses and PSWs, and they voted with their feet and left by the thousands, of course, because every few years, you know, their company, if they, you know, had decent wages or anything, would lose the contract to another company, and they'd lose their seniority, their vacation, everything else, and have to start again with a new company, right? So they left by the thousands, and ever since then, staffing shortages have been epidemic across home care. Even when they froze the bidding process in place. Under the privatization system, not only did they have to kind of change the practice of home care to fit into widget-like visits, then they made the visits smaller. The companies would bid on volumes of service, 10,000 hour-long visits. Then it became half-hour visits. And then the last time we did a major home care report, the workers told me that there were 15-minute visits. So they would be sent into a retirement home to clean someone's privates in 15 minutes and then move on to the next person. If you can imagine how dehumanizing both providing and receiving that kind of care would be. By 2015, there were 1,000, so this sort of fits what everyone is describing, I think. And then to get to Dr. Berman's point, by 2015, there were 1,500 service agreements, contracts with companies to provide home care, more than 14,000 billing rates, hundreds of millions of transactions annually. And every one of these companies having a duplicate administration, you'd have to run the bidding system for all of that, all of the administration required to do that, just to keep up kind of a farce of managed competition. Because the truth is there's one workforce, as Connie was describing, you know, there's one workforce, whether you have a private for-profit company or not. If one company loses the contract, they aim to hire all of the people who are laid off from that company. And the for-profits make their money by different wages and working conditions. So there were the studies that were done of the initial, like earlier home care contracts. At the time, they were paid $19 by the government per visit for home support. And the for-profits took $7.70 to $8.60 out of that $19 as their markup for their profits. That means that about 40% to 45% of every healthcare dollar taken by the companies, the for-profit companies, goes away to overhead and profits and doesn't actually make it to home care at all. So to Dr. Berman's point, you know, why would we have a private for-profit system? It was always set up to meet the interests of the for-profit providers and not people like James's brother-in-law or Penny, or people who are trying to access home care. In fact, to the detriment of them, this whole system is set up to have volumes of service that are, Nicole's daughter, volumes of service that are contracted to these companies. And it has come at the expense of a humane, holistic, compassionate system of home care. Just the last piece. So the Liberals froze this system in place. They didn't actually fundamentally change it. They increased the caps. The Harris government was the one that brought in the caps on the amount of services you could get. The Liberals increased the caps. Then, the Ford government announced that they were increasing them more. But the bottom line is, if the funding isn't there, it's still very, very rationed. And if the staff aren't there, there's no one to provide the care. So it doesn't matter how much funding you have, you can't get the care anyway. And increasingly, they don't want it provided through agencies anymore. They want to have people have to hire and fire their own staff and manage their own staff in the way that Nicole was describing, sort of another deeper step of privatization. And then finally, the Ford government also has brought in a new law in the middle of the pandemic, if you can believe this, to privatize the last remaining public parts of home care, to allow the companies to subcontract the case management and care coordination functions and so on between themselves. So it's another deeper step in privatization. I guess I'll just end this by saying this. There's no question that this is fundamentally about a fight about profit taking and greed versus the public interest. That we are going to have to mount a major fight now that the Ford government is dismantling the last remaining public structures in home care. We have to build a vision of a public home care system again. We have to push the Liberals to adopt that and to give up on their ties with the for-profit companies. We have to push the NDP to push for that, and whoever forms the next government to rebuild a public not-for-profit home care system. In the meantime, we have to fight like hell for Penny, for James, for your brother-in-law, for Nicole, to ensure that we drag out of them the money, the funding, and the services that you need. And I was going to propose that we hold a press conference following this to at least expose this in a shorter way and demand change. It's the first step that we could take together. Thanks.
Thank you very, very much, Natalie, for pulling a lot of that together for us. It was really, really important, I think. And we have time for a few questions. There's been a very rich dialogue going on in the chat, as people have probably been noticing as we've been going through this meeting. Many questions that people put forward, others have answered for them, and it's a really important dialogue, which is great. But we do have an opportunity for a few questions here. If anyone would like to ask either a question or put forward a point of view, I will take them. Sarah, I do see your hand.
Just very brief. What happens, at least in our experiences, is that the part of the family that has money, they can get good care. They're paying $100,000 a year. The issue is for all the rest of us, it's the public system. So all the people they consider important, people with money, they don't feel this, they don't see this. And it's $100,000 a year. But for the rest of us, it's what everybody here is experiencing. And it's breathtaking. Just tonight, we get more information.
Thank you, Sarah, for that. Thank you. Shalom, welcome.
Thank you. I have put in the chat a number of areas where home care workers are denied effective collective bargaining rights. And one of the possibilities may be a charter challenge that the new approach to, in fact, even do away with home care agencies and require individual care recipients to hire their own violates the freedom of association of home care workers.
Thank you very much, Shalom. I'm looking, is there anyone else who is interested in making a comment? Drew, please.
Yes, hello everyone. I am a ventilator dependent quadriplegic and I'm on direct funding and I have to hire and do all the scheduling, payroll, training of all of my PSWs for 24/7 care. And back in 2013, when I was looking to move home from the hospital after my accident, they told me that it would cost me $550,000 a year for 24/7 care in terms of nurses. And now it's costing the government $200,000 for me to be at home. But obviously, we are so short-staffed right now. Nursing agencies, I've had to combine with multiple nursing agencies to make sure I have a nurse every day, and it's just been a disaster, especially since pandemic and even before the pandemic. So it has been a crazy thing, and I'm fighting to make the difference as we go forward as well.
Thank you. Thank you, everyone, for actually making your comments quite brief, but quite to the point. We appreciate that very, very much to allow more to speak. Isabella?
Yeah, hi, everybody. I think one of the biggest problems that you have with PSWs and that, I had PSWs come into my house, 15 years ago, and it was good for a while when I had this one worker that was really good. I had him for about 2 years, but then he went and moved to the States and got a different job there. And then I had trouble. I had one guy come and do my laundry wearing a suit. And I was just came out of the hospital and I was sick and recovering from a surgery. And, when they brought my laundry up and left it with the bags, tied up, I just figured it was all done and dried. And I was in bed for 3 days after they left. And then when I went to go get something out of the bag, it was all soaking wet. Another time, a person did my laundry, they melted the mattress cover and lost a bunch of my towels and sheets. And another time they cleaned my microwave and they used one of those steel curly cues inside the microwave, and a piece of the wire went and wrapped around the turning mechanism. And then when they left and I went to use the microwave, I was sitting and all of a sudden my apartment's full of smoke. I'm watching, it's like, what's going on? Oh, it's the microwave. So you know what I mean? It's toasted my microwave there with that. And when I complained, I just lost the service completely. But it's like people need help with washing their floors and washing their windows, and it's not just about having a bath. And I think one of the biggest problems you guys have is the same problem we have with ODSP and OW, is all these well-intentioned, good-meaning people, advocates and activists that are not asking for enough, and then they accept even less. And over 20 years, this is the result of that. When people don't ask for enough for what people need, it's called ableism. It's like saying, we don't believe you're that disabled. You can do the rest. You can go earn the rest of the money that you need, because we don't really think you're that disabled. And this is the problem. But all these people, you know what? It's a lot easier to fight for less than we need. We all know that. But what I call out ableism, all of a sudden I'm the enemy. But it's not me that's the enemy. It's ableism that's the enemy. But people would, wait 1 second, let me finish. People would rather say that I'm the enemy, and that I'm a problem and I'm not cooperating because I'm not willing to accept ableism. I'm not willing to accept less than we need. So I'm a dictator, I'm a narcissist, I'm all kinds of things that they can make up. And you know why? Because they don't want to change their demands. They don't want to make their demands so that they're not ableist. Just change your demands. How is that so hard? Everybody's got to get on the same page. And that's the thing. We can't get everybody on the same page. How do we get everybody on the same page?
Isabel, we're trying our best and no one's trying to shut you down here. You know that.
I know that's.
Yeah. No, we appreciate your comments. Thank you so much. Faylene? And let's reach for the moon, right? Faylene, go ahead.
Oh, sorry. Yeah, I just wanted to, I'm really glad that this forum happened tonight. And I think one of the most encouraging things about it is just, actually hearing from Connie and hearing from people who are dealing with the home care system that is not providing what they need, obviously, that has been privatized to not meet people's needs. but seeing that we need to build a united fight with the workers who are doing the work, as Connie described, and want to be able to do it in a humane way, but aren't able to because of the privatization and the profit making at the government level. So I think if people haven't heard about Ontario Health Coalition's campaign to prevent further privatization, go to the website, sign up to be a public healthcare defender. And I wondered if maybe, I don't know if the speakers will be coming back at all, but I wondered if Natalie could talk a bit about the referendum campaign that we're going to be waging. If there's not time for that, that's fine. You can find it on the website, but a great forum tonight.
Thank you, Faylene. Michelle?
Yeah, I think what Faylene said kind of captured really what I was going to say is that there's, if you don't have a sense of urgency after hearing what we've heard tonight, and I know a lot of the people on this call have heard many aspects of this over the past months and years, but there's an urgent need to push back against the completely on purpose process that was set in motion many years ago to create a crisis, underfund things, cut things, and pit the people who need services against the people who provide the services. But meanwhile, it's not Sylvia Jones who's going on the doorstep and providing care for somebody. It's going to be someone like Connie. It's going to be other PSWs. It's going to be other workers who are having to face the awful reality that is being created by these cuts. And I mean, honestly, someone, I think Natalie said, who remembered Harris and all that. And I mean, when you go back to that point, if you remember the very first thing he did when he was elected, he cut welfare by 21.6%. And you imagine what that has done. That's just one section. The cuts in hospital beds, the cuts to the services, the cuts to public housing, it just goes on. And we're living with that reality. Every single thing I've heard described here tonight comes from this decades-long process of grinding it down and undermining it and hollowing it out. And right now, actually, we're at a tipping point because what Ford is going to do around hospitals with Bill 60, it's like the ice, not even the icing on the cake. It's actually the prize they've been after for since the beginning of Medicare, is to privatize hospital services. So they've privatized home care, long-term care. And so I do hope that we can have a minute to really talk about what we can do, because there's a massive campaign getting underway here that will, if it's successful, I think is going to raise the expectations, because everybody who says we need to change is right. We need to raise expectations. We need a vision of a fundamentally transformed system. And unless we grab the moment, because there is a moment that is hot right now. I don't know if people are feeling that, but there is a real growing anger at what Ford is doing. During COVID, he got away with a phenomenal amount, but it's over now. And now they're using that immense crisis that provoked in our healthcare system to come after the prize they wanted all this time. So it's urgent we be united, but we also know that we're going to be experiencing things very differently. The folks who are working as PSWs are not the enemy. They are the ones who are, we desperately need to help those workers raise their conditions and raise their wages, just like we have to support the nurses right now who are in the fight of their lives against the kind of just criminal neglect that they've faced as well. So anyways, thanks everyone who's contributed to this meeting.
Thank you, Michelle. And I think I'm only able to take 2 more speakers because we do want to get to that next step. So Alexander?
Yeah, thanks, Carolyn. Hopefully everyone can hear me, and hopefully I can express myself in a coherent and meaningful way. I've heard a couple of things tonight. One, Natalie, you mentioned about, I think it was you that said about a press conference after the session tonight. And I have to admit, most of the information I receive about the situation, I'll call it, is via email. I get emails from the Ontario Health Coalition and I read it, and that's how I become informed. Or I go to the website. So you mentioned press conference. I guess my question is, do we have relationships with the media outlets so we can mount some kind of a cohesive, methodical broadcast so that the general population in Ontario will become aware of the dire situation we're in? I don't know the answer. I'm just asking and putting it out there. And I'm willing to do what I can to help out in any way, shape, or form. So that's really my question. I feel everyone's frustration. I'm frustrated hearing the stories, and gosh, I mean, we've got to do something. And oh, the other one was somebody mentioned referendum. I think it was Faylene, you mentioned referendum. What are we doing about it? And how quickly can we mount the referendum to make the point to the political parties that we mean business? We need to get to the bottom of this and stop this craziness that is happening. I have a home in Florida, and I can tell you, listening to my neighbors talk about the frustration they're having, if you look at the number of foreclosures of homes in the United States compared to Canada, it is 0.25 versus 0.14. It's much higher in the US. And a lot of the friends and people that I know in Florida, that one of the big concerns is that they have to mortgage their homes to be able to pay for their medical bills.
Yes.
And every time I hear those stories, I cringe because I think, thank God we don't have that problem. But here we are, we're marching headlong into that kind of a situation, and we've got to stop it.
Thank you, Alexander. Thank you very, very much. I see we have two speakers. If you both can be very short, we'll get you both on, but I do want Natalie to come back to talk about the referendum and our next step. So Helen?
Okay, I'll be short. It's been very interesting listening to all of the speakers. In future, I would like to hear a speaker from mental health. Because if these patients are having problems, I have a mental health issue. Fortunately, I have a family that dragged me up to Ottawa to get the proper services because I could not get them where I was. But I've talked to other clients, and they just are unable to get the help that they need for long enough that they can be figured out what medication or other use or other things they need in order to stay balanced. And if things are going wrong in other areas, you know that they're going wrong in mental health as well.
Thank you very much for that. And then our last speaker, Kathy. Kathy? Are you muted?
Oh, sorry, I am muted. So one of the things that someone said to me was that we need to, clearly point people in the right direction. There's a lot of people that really don't understand what's going on in long-term care, home care, and in healthcare. And there's a lot of misinformation. The current government seems to love to spin doctor things. And one thing is that our system is publicly funded, but a lot of it is private already. So the terminology, just calling out private, they twist that so much and make it into something negative. I think we have to plug that it's for profit, and the thing that's different from private and for profit is patient centered is our current system of public private, and the for profit that it seems that's coming our way would be more centered on focusing on the owners or the shareholders. And that would be sort of the end all and be all for money going in and out of the system. So I know that Ford and the media, a lot of things get twisted around. And I think we really need some clear messages. And like was said earlier, you need like some kind of methodical media campaign with these messages, with impact, with numbers that will, get more people to the referendum. Because I think a lot of people are just too busy and too apathetic. Anyway, that's my point. Thank you.
Thank you very, very much, Kathy. And I'm now going to go to Natalie. because we're just coming to the end. Oh, Nicole, did you want to say something before Natalie?
I just wanted to say that I don't think anybody really knows the real numbers of people in home care that don't actually have services, because a lot of people have been discharged. So I know a lot of families with children in the community that have absolutely no nurses coming into their home. They've lost all their nursing hours. So I think that's one key thing. I'm not sure how to get those numbers. I don't think the home and community care organizations know what those numbers are. The government doesn't know how many people don't have supports in the community. I think that's something that I don't know how to get those numbers, but I think that's critical in our fight in showing just that big discrepancy.
Thank you very much for that, Nicole. And Natalie, you want to bring us back to what our next step, explain a little bit about the referendum and what we're looking to do.
Okay, thanks, Carolyn. So very quickly on this issue specifically, home care, if you personally receive home care and like Drew or Nicole or Penny, have a personal experience and can speak at a press conference, be it by Zoom or in person, can you indicate in the chat? Similarly, if you're a family member or a care worker, like a doctor or a PSW or a nurse or a health professional, and willing to speak publicly again at a press conference or a series of press conferences, can you put it in the chat? The way that we build fightbacks, and yes, we absolutely have lots and lots of media connections. And, the way that we sort of change the political context is that we make a fightback that's impossible for them to ignore. Like during the pandemic, Shalom is here and he did the first report for us where we counted up and identified how many deaths were happening in the for-profit long-term care homes versus the not-for-profit and the public, and found that was a sort of seminal report. And the media all sort of copied that, made their own databases and kind of went to town from there, and it became a major issue. And even though we didn't move the Ford government off it, we moved the Liberals to from a position where they were actually not willing to end for-profit long-term care to a position where they actually have adopted the position of ending for-profit long-term care, and the Conservatives to actually trying to hide in every way, and then promising to regulate up and promising to make changes and improve and so on and so on and so on. And then some of those things actually sort of becoming real, but it's a big fight regardless. But that's how you kind of shift the envelope. We just, home care is invisible. And, I just wanted one other comment, which is that I wanted to amplify what Connie said about her analysis. The workers are exploited. It's racist. It is absolutely gendered and racialized. And we have to recognize that, and we have to amplify and call out that practice. It's not acceptable. And so I just wanted to say that. So the first step for us in home care, let's hold a press conference. Let's make it real. Let's make the people and the stories real. Let's start to make it a public issue and push. We are holding a referendum, a province-wide referendum, to stop the further privatization of our healthcare. As I mentioned, the Harris government privatized home care. It's been a disaster ever since. They privatized long-term care, that's the nursing homes and so on. We have seen the consequences of that in the horrific death rates, the standards, the quality of care, the quality of life, and the exploitation of the workforce in long-term care, particularly in the pandemic, where it was really cast into sharp relief, but ever since. And it has been hell to try and fight out the for-profits once they're in. Now, the Ford government is coming for the hospitals, and they want to privatize the public hospitals. So in order to stop that, we're holding a referendum province-wide. It's a citizen-called referendum. So we're going to run it. We're going to call it. We're going to aim to get 1 million people to vote. We want to have voting stations outside every busy corner store, every drugstore, every Tim Hortons that we can, coffee shop, natural food store, busy places in the community where there are lots of people, on Friday, May the 26th and Saturday, May the 27th. In every town across Ontario that we can do it. We're working with volunteers who will, even get one voting station in their town if it's a small town, or if it's a larger community with local coalitions and key contacts who are forming groups to have 20 voting stations in that community, and so on. With unions and non-unionized people who either own companies or work in workplaces, we're going to hold workplace votes in the 2 weeks leading in. There'll be online voting in the 2 weeks leading in. And again, that is to stop the privatization of the hospitals, but it all contributes to creating a context in which privatizing healthcare becomes something that all of them get pushed back on in a very significant way. And we can carry on from there to build the fight bigger and bigger and bigger. So the first steps here, one, press conference and action following up from that on home care. Two, massive cross-province referendum with a goal of mobilizing 1 million votes. A large petition in Ontario would be 20,000 signatures. No one ever gets 1 million people to do something all together on politics in this province. It would shake any government. We already have 800,000 members or so in the Health Coalition. I believe we can get to 1 million votes if we, all of us, do the piece that we can, even if it's, volunteering at a voting station for 2 hours on that day, or bringing a ballot into your workplace and a ballot box and doing a workplace vote. Like, everyone can have a role. So to that end, the last thing is Riley has a list. We have upcoming organizing meetings. These are not for speaking heads. They're to organize the referendum, town by regional ones, starting this Wednesday when we're doing the Southwest. And there are people on the call from all different regions. So Riley, do you want to just put up the list? I see you've copied it into the chat, or can we just read it out for people so they can write down when theirs is? And it's up on our website, right?
Mm-hmm.
Riley, can you share your screen and show it? I don't know if he's here.
Sorry, I'm here.
He is. Yeah, he's right
I
there.
can read it. I just was having problems with my screen.
I'll share my screen. Okay, I'll find it, but you go ahead, hun.
So the first one we have is the Southwest, which is this Wednesday. So that includes Guelph, Windsor, Sarnia, Chatham, London, St. Mary's, Kitchener, and Oxford.
So to
and
be
that's-
short, that's from Guelph down to Windsor,
Yeah.
and includes Woodstock and Oxford County. Sorry.
And that's Wednesday, March 15th at 7 p.m. And the link for that is in the chat to register. The next one that we have is Peterborough and Kawartha Lakes County. So that includes the Haliburton Highlands and Northumberland. So that's Monday, March 20th at 6:30 p.m. And the link's in the chat as well. Then we have sort of Eastern Ontario, which is from Belleville to east all the way to Ottawa, Cornwall, Perth, Smith Falls, and Kingston, Hawkesbury, Renfrew, Pembroke, and Petawawa. And that is Tuesday, March 21st at 7 p.m. Then we have the Niagara region, which includes West Lincoln, St. Catharines, Thorold, Niagara Falls, Niagara-on-the-Lake, Fort Erie, Port Colborne, Welland, and Wainfleet. I might be saying that one wrong. Sorry.
That's right.
And that's Wednesday, March 22nd at 7 p.m. Then we have the Greater Toronto area. So that's Toronto, Scarborough, Etobicoke, North York, Peel, Caledon, Newmarket, Aurora, Markham, and Stouffville. And that's going to be Thursday, March 23rd at 7 p.m. And if you are part of the Toronto Health Coalition, we had originally had a local coalition that night. So we've just merged it into the organizing meeting there too, in case you're confused. Then there's the Durham region, which is Pickering, Bowmanville, Pickering to Bowmanville, including Oshawa, Ajax, Whitby, and Port Perry. That's Saturday, March 25th at 10 a.m. Then we have sort of the central region, which is Simcoe County, Grey Bruce, and Muskoka, which includes Huntsville, Berks Falls, Bracebridge, Gravenhurst, and Parry Sound. That's Monday, March 27th at 7 p.m. Then we have the Northwest, which is Wawa West and North, including Thunder Bay, Dryden, Kenora, Fort Francis, Atikokan, Atikokan, sorry, Sioux Lookout, and that is Tuesday, March 28th at 7 p.m. Then we have Hamilton and Halton Hills, Oakville, Burlington, Milton, Brantford, including Burlington and Brantford in there as well. Wednesday, March 29th at 7 p.m. And the last one that we have is for the Northeast, which is Sault Ste. Marie East and North, including St. Joseph's Island, Sudbury, Elliott Lake, Blind River, North Bay, Iroquois Falls, Timmins, and as far south as South River and Sterling Falls. And that's Thursday, March 30th. So we have a busy couple weeks, and we could definitely use everyone's support to help us get boots on the ground and get this up and running.
Thank you. Thank you very much. And go, Natalie. Go ahead, Natalie.
No, just very quickly. So we'll email that with the follow-up email to this for everyone who came to this meeting or registered for this meeting. We can email that list out because there are people here from all across Ontario. But if there's one thing you do, if you can join that and even do a small thing to help with the organizing, clearly, to get to 1 million votes, we're going to need tens of thousands of volunteers just to do what you can do. We're not asking for the world, but just, it counts now to add your voice, to add your body into this fight. This is it, and from here, if we can push them back, it just changes the way that the political culture happens, as you start to roll this stuff back, the chance of us being able to roll back home care privatization and long-term care privatization and the privatization of virtual care and so on becomes bigger, and we don't have any choice. This is what we have to do. Otherwise, we accept the endless, relentless erosion of our public health care and the end of those principles of equity and compassion that are supposed to underlie it. So thank you.
Thank you, Natalie. And we're now unfortunately having to end the meeting, but I want to say I was at a Steelworker Area Council meeting this afternoon, and I raised this referendum, and you wouldn't believe the number of unit chairs in our workplaces across Toronto and York Region who wanted to set up a polling booth in their lunchrooms during this referendum. And I think that tells you people want this to happen. And 1 million votes may seem like an awful lot, but I think we can do it if we get the volunteers, if people sign up, and wherever you can do it, a farmer's market, a community center, a school, a campus, a workplace, wherever. Let's do it, because I think people will respond. And this is the public pressure we need, the momentum we need, and connecting with all the other struggles that are going on. But this is crucial. And we've got a terrific organization, the coalitions, all the different areas across this province that are covered. We're there, we're doing it. The staff and the volunteers are working like the devils to make this happen. And we need more and more and more. So those of you in the Greater Toronto area, come to our next meeting. It's look on the website. It's coming up very soon, and we've got your emails. We will get you out. That meeting is Thursday, the 23rd at 7 p.m. Get involved, become a defender, and we can win this. So I just want to thank all of the spokespeople today. Hal, who was there, James, Nicole, Connie, Penny, Natalie, everyone who contributed both in the chat and the questions and comments that were raised. We've got a vibrant movement here, a vibrant movement that it's a people's movement. We can make this happen because as has been said so many times, they are few and we are many. We just have to channel that energy, that collective power that is ours, and we can do this. It's an historic fight. These things have happened before. The people have won. We can do it with all the combination of the caregivers like Connie and the physicians like Hal and those who are requiring the services, those who are taking care of those who are requiring the services. All of those coming together. That's what the OHC is. That's what the Ontario Health Coalition is. That's what people like Natalie have been doing for years, dedicating themselves to this. And we're showing that we can do it. And I have no doubt. So allow yourself to be inspired by what happened today. There's the grouping that went on today, just dynamite. So thank you all so much for coming out tonight.
Carolyn, I want to add something. We did a referendum before COVID for a hospital that was being closed, and we went to we delivered them all at Queen's Park, and it worked.
There you go. That's it.
I was there when we did it. We had boxes and boxes, and we dumped it at
Here you go. Well, that's exactly what we want. That kind of encouragement and confidence.
Anybody that's new here that doesn't think it'll work, it does work.
Absolutely. And thank you and everyone who contributed through the chat, through the questions, through the being on the panel. We have got a very real movement, people's movement, workers' movement, and with it, we can win. And thank you for that ending comment, Penny. I think that confidence just gives us what we need to push forward. So thank you, everyone for coming out tonight. We will see you soon. This is
Thank
far
you,
from over.
GTA Health
Thank you.
Coalition. Thanks,
Thank
GTA
you.
Health Coalition. You
Bye,
did a
everybody.
amazing job. Riley, will you save the chat before we go?
Yeah, I've got it saved.
Okay,
Excellent.
thank you.
Thank you so much, everybody.